on that coin.
Okay.
Hey, when is happy hour, I guess, right? 5 o'clock. Bye, guys. Have a
All
good
right.
one.
Thanks,
Take care.
Ruben.
Thank you. Thank you.
We'll see you in a little while. All right, well, a new year, a new you. You've tried diet, you've tried exercise, and you're just still not 100% happy with the results. Well, maybe time to talk to our next guest. Dr. Daniel Brown is here this morning. We're going to talk about the 3 most popular forms of plastic surgery right now. Plastic surgery and reconstructive surgery, your specialty?
Absolutely. And, you know, I want to thank you again for having me back on San Diego Living. It's a pleasure to be back.
Well, it's nice to have you. And this is a topic that it's discussed so openly now. People are, you know, they don't sneak around and have procedures done anymore. They're proud to say, hey, you know what, I tried diet, I tried exercise, now I'm going to try lipo. I would think would have to be in the top 3.
Absolutely it is. It's actually number 2. So what we wanted to talk about is, you know, as the new year begins, people are saying, you know, I want to get started on those resolutions that I made. I want to look better, I want to feel better. And we want to give them some information about that. So last time we talked about the non-surgical options to look rejuvenated for the holidays, Botox, Juvederm, Latisse, etc. Now I want to talk about the top 3 surgical options that people can have and that are going on out there, and really educate about the plastic surgical options, not the non-surgical options that are going on out there.
Oh, well, let's start with number 1 then. If lipo's not number 1, what is?
Number 1, breast augmentation.
Ah, okay.
Breast augmentation is basically the procedure that women go through to make their breast fuller, more beautiful, feel more feminine. The ideal candidate for a breast operation and a breast augmentation operation has really always wanted to increase their size, or has undergone a pregnancy or weight loss, something like that, and really lost shape and volume in the breast. And a breast augmentation can really make a woman's breast more full, more feminine, just restore that harmony and balance back to her life, and, you know, as long as maintaining that natural look and feel.
Now, there was a concern, you know, for a time about the implants and so forth. Now, I'm not hearing that in the news anymore. Has that concern pretty much been solved?
As of 2006, you know, the FDA approved the use of silicone implants again in breast implantation. They've been essentially cleared of any association with autoimmune diseases or anything like that. All of that controversy has really been put aside, and they're for use in reconstruction as well as cosmetic augmentation now.
All right, let me just tell folks right now what the doctor is offering today. The first 20 callers, 20% off of any plastic surgery procedure, and it'll also include Botox and Juvederm, which are the non-surgical alternatives there as well. So we'll talk more about that before we finish up here. Okay, number 2 then, you said was lipo. Who's
Correct.
a candidate for lipo?
Ideal candidate for liposuction is a person that has localized fat deposits. Those localized fat deposits, basically you can see them in people's necks, chest, most frequently in the abdomen, hips, or buttocks, and those areas basically that are resistant to diet and exercise, namely the abdomen and hips, as everybody knows. So the procedure basically involves taking a small cannula through a very small incision, removing that excess fat after the area has been numbed up and a solution has been injected to prevent bruising, and restoring that youthful contour. You know, the procedure usually takes an hour to 3 hours, can be combined with other plastic surgery procedures, and several areas can be done
So,
at once.
as long as I'm there.
Correct.
Okay.
Correct.
All right, let me talk about number 3 then. Is that the tummy tuck?
You are correct,
Number 3,
sir.
okay.
The ideal candidate for a tummy tuck is someone that just through, again, previous pregnancy or age or massive weight loss has lost that firm, tight belly. They want to go back to that. They're motivated to go back to that, and they want to restore that youthful contour. So removal of that excess skin and fat is important, not the most important. The most important is getting that abdominal musculature that's been sort of stretched and separated, strategically put back together so that you really have that firm, muscular abdominal belly that most people want.
What some people don't understand is there's actually damage done to the muscle wall through pregnancy and maybe having a C-section or something like that. And sometimes you have to really go in and repair that musculature underlying and then pull that skin tight and everything, and then you get that look that you're after. So it takes a skilled surgeon like yourself to be able to understand all the implications.
It does.
Well, okay, well, the first 20 callers then, 20% off of any plastic surgery procedure, but you'll also include Botox and Juvederm for the non-surgical alternatives. Get rid of those wrinkles. It's a pretty good deal. Doctor, it's always great to see you.
Great seeing you as well. Happy New Year.
Happy New Year to you, too.
I really appreciate it.
All right, for more information, you go to sandiego6.com. All right, still ahead, we're talking short sales and home affordable foreclosure alternatives. Brian Garrity joins us.